Hello everybody, this is Dr. Arvind. I am a kidney specialist or nephrologist as well as a transplant physician. I am here to talk about kidney disease today. The kidneys are two organs situated at the back behind the stomach in the abdominal cavity. The kidneys do several work apart from removal of urine. That is, it tends to remove water from the body. Along with removal of water, it also removes toxins. These toxins may be in the form of urea and creatinine, which we commonly measure in the blood. It could also be other toxins that we don't know about. The kidneys, apart from removing water and toxins, has several other functions. These functions include activation of vitamin D, which is very necessary for bone formation and strength. It also helps removal of acid from the body, which is quite important because protein breakdown causes acid formation in the body. It also helps generate a hormone called erythropoietin. This hormone is quite important for the bone marrow in the production of blood. So you realize that the kidney has several functions apart from toxin excretion. Now let's talk about kidney disease. Kidney disease, when the kidneys start to fail, there are two types of failure. One is acute kidney failure, where the kidney failure is sudden, and this we term as acute kidney injury or acute renal failure. This can happen in instances where disease processes like infections, for example, malaria, dengue, and the like, in the presence of other infections like diarrheal diseases, where diarrhea or gastroenteritis can cause severe dehydration in the body and can lead to kidney failure. Other common causes of kidney failure here in India are snake bites, where the toxin of the snake can cause kidney problems and acute kidney injury. These are some of the causes of kidney failure that can happen suddenly or cause acute renal failure. Moving on to chronic kidney disease or chronic kidney failure, two of the most common diseases that are present here in India are diabetes mellitus and high blood pressure or hypertension. Diabetes mellitus is quite rampant in our country. India is now slowly becoming the diabetic capital of the world, overtaking China, and up to about 50 to 60% of patients in most dialysis units tend to have diabetic kidney disease as the common cause for kidney failure. It is important, therefore, that we prevent such disease. High blood pressure is the second most common cause perhaps in the world, definitely a common cause of kidney failure in India as well. Apart from these two, chronic glomerulonephritis. Nephritis is a disease process that occurs within the kidney and causes both high blood pressure, protein excretion in the urine, as well as kidney failure. Chronic glomerulonephritis is a common cause of kidney failure in India. Apart from this, we have to understand that chronic interstitial nephritis or an allergy within the kidneys can give rise to kidney failure. This is also a common cause of kidney failure in India. Adult polycystic kidney disease is a disease process that is genetic in nature and can be transmitted down the generations. This can also cause kidney failure. While diabetes and high blood pressure are some of the common causes for kidney failure, these are the other causes that can lead on to kidney disease. What are the symptoms of kidney failure? You have to understand that early on in patients who develop kidney failure, there may be no symptoms. So a patient with some degree of kidney failure, let us say stage 1 or stage 2 of kidney failure, will have no symptoms whatsoever. It becomes very important, therefore, that patients, especially patients who have diabetes and high blood pressure, should check their kidneys from time to time to see whether there is any problem with them. The best way of checking this is by doing a small test called serum creatinine level. This is a blood test that costs about 50 rupees, as well as a urine protein level. This is also another test that costs about 50 to 100 rupees. These are very cheap tests, very available everywhere in the country, and can be done immediately. Reports can be available within an hour. Both the creatinine and the urine protein value will tell you how your kidney is doing. Is there kidney disease or is there kidney failure? Coming back to the symptoms of kidney disease, as I just said, kidney disease may be totally asymptomatic. There may be no symptoms initially. However, as kidney disease advances, you may develop some symptoms. These symptoms include a decrease in the urine volume, the presence of edema or swelling in the feet or swelling near the eyelids, the presence of vomiting or distaste to food, the presence of a breathing problem or dyspnea or exertional breathing issues, as in when the patient starts developing fluid within the lungs, he tends to become breathless. Other symptoms include itching, lassitude, weakness, and pain in the bones. You have also to remember that initially or even in advanced kidney failure due to certain diseases, there may be no decrease in the urine volume. So a patient who has kidney failure may still pass about a liter or a liter and a half of urine per day. And this basically means that urine volume is not a good measure of kidney function. Please remember this. This is very important. Moving on from the symptoms to the tests that we do to look at kidney failure, and we have already talked about this. Blood levels called serum creatinine and blood urea are quite important tests that we do to pick up kidney failure. Urine test for blood in the urine called hematuria, or urine test for protein, which is quite important because protein leaks early in diseases like diabetes, in high blood pressure, and in a kidney disease called nephritis. These are the two very important tests that we do to diagnose kidney disease. Also, kidney failure patients tend to have other problems, so we check the hemoglobin to look for anemia or a lack of blood strength. We also look for vitamin D problems, where patients who have kidney disease do not activate their vitamin D. So calcium and phosphate levels in the blood are looked at. Calcium levels may be low with kidney failure. Phosphate levels may go high with kidney failure because it is not excreted in the urine. Vitamin D levels are also looked at, and in recent literature it has been described that many Indians have a lack of a vitamin D level. We also do an ultrasound scan of the kidneys. An ultrasound scan of the kidneys picks up the kidney sizes and tells us whether the disease is chronic or acute. Kidney disease that is chronic or long-standing means that the kidney sizes will be smaller, whereas kidney disease that is acute will be picked up as normal kidney sizes. Also, in patients who have diabetic kidney disease, you have to remember that the kidney sizes may actually be normal. So in such patients, kidney sizes do not help in diagnosing kidney failure. Other tests that we tend to do in patients with kidney failure include a scan of the heart and an ECG. The scan of the heart is called an echocardiogram. This is basically because you have to understand that patients who have diabetes, high blood pressure, and kidney disease may tend to have heart disease in addition. Other ways of imaging the kidney, apart from an ultrasound scan of the kidneys, include a scan called the CT scan as well as an MRI scan of the kidneys. These are only carried out in special situations where a stone needs to be determined, or the location of the stone within the kidney or urinary tract, as well as MRI scans are done sometimes to look at the blood vessel architecture of the kidney. These are other tests that we need to do. The most important tests, investigations that we do in kidney failure are the blood test and the urine test. Coming on to treatment of kidney failure, let us look at acute kidney injury or kidney failure that happens suddenly. In this, we tend to treat the diseases, and therefore we hope that by treating those diseases, the kidney failure improves. One, we tend to give IV fluids to manage the dehydration. We tend to treat malaria, gastroenteritis, dengue, and other infective diseases that cause kidney failure by treating those particular diseases with antibiotics and such else. So supportive treatment is what we do in such patients. In patients who have acute kidney failure, who need dialysis, we put such patients on dialysis. Whereas the kidneys in such patients tend to improve over time, so dialysis here is temporary. Let me talk a bit about dialysis. Dialysis is of two types. One, hemodialysis or blood dialysis, where the patient comes to the hospital and gets his dialysis done with the help of a machine called the hemodialysis machine. Two, CAPD or continuous ambulatory peritoneal dialysis is another form of dialysis that has come up recently over the past 20 to 30 years and has been done in patients who don't wish to come to a dialysis center. I should explain that CAPD is a dialysis that is preferred in patients with chronic kidney disease. Chronic or long-standing or permanent kidney failure occurs in patients who have diabetes and high blood pressure, and with time these kidneys fail permanently. In such situations, the two types of dialysis that we offer are hemodialysis and peritoneal dialysis. Hemodialysis in these patients is usually done 3 times a week. The patient comes to the hospital and is hooked on to the hemodialysis machine by means of a catheter called the internal jugular catheter or the femoral catheter. These are catheters that are placed either in the neck or in the thigh to facilitate an access to the vascular compartment in the body. Also, such patients can tend to go through a very minor procedure called AVF formation. AVF is arteriovenous fistula, which is a minor surgery that is done on the arm, and these patients can tend to do the dialysis from the veins in the arm or forearm thereafter. Remember, dialysis is a painless procedure and there is absolutely minimal pain in this form of dialysis. CAPD or continuous ambulatory peritoneal dialysis is done in patients who prefer not to do hemodialysis, who prefer to stay at home and do their dialysis, or those who have heart or cardiac conditions with low blood pressure where CAPD would be the better option. In this form of dialysis, a catheter is stuck into the abdomen and dialysate or a water or a fluid substance is put into the catheter into the abdomen through the form of bags called dialysate bags. These patients tend to undergo dialysis on a daily basis and can do their dialysis on their own or with the help of their relative. Both forms of dialysis offer the fact that the life can be prolonged. Patients with kidney failure can live up to 5 to 10 years or more on dialysis. The better form of treatment for kidney failure patients, especially chronic kidney disease patients, is kidney transplantation. There are 2 forms of kidney transplantation available: live related kidney transplantation and diseased donor transplantation, where people who die in road accidents with head injuries or people who have bleeding within their brains are declared brain dead and their kidneys are harvested and put in a patient with kidney disease. Kidney transplantation is the best possible treatment for kidney failure. Dialysis is the second best option. Those who have relatives who are willing to donate kidneys should go in for kidney transplantation. This is the best treatment on offer. Thank you.